Are we live yet, Wendy? Oh, there we go. Good afternoon, everyone. Welcome to Town Hall for this week. We're going to do a bit of an information session on the COVID-19 vaccine for 5 to 11-year-olds. And we've got a panel of experts with us, or information providers, in myself, Dr. David Makary, our Chief of Family Medicine, who will support the panel, and as well Miss Andrea Fretz, who is our Child Life Specialist with the Maternal Child Program. We did have Dr. Mohit Singla, who's our Paediatric Cardiologist, but unfortunately he's been detained in his office. So he supported us with information, and we will share that with you as well, because I'm sure there will be lots of focus around myocarditis and things of such related to the cardiac implications. So I think we'll start by, I'll share a little bit of information about the COVID-19 vaccine for this population, and then we'll let Andrea speak a little bit as well, and then really move to the question and answers, some of them pre-submitted or other ones coming into the chat to really, answer your questions, provide resources and information that we're aware of, and then equally support our community internally and externally for any further ongoing support and questions they have. So as everyone knows, yesterday the first vaccines were given in Toronto, in fact, for this population through Sick Kids Initiative, and had their first patient population, and it was really wonderful to see. I think the Minister of Health was there just giving her support, as well as calling those particular children, heroes in their own way. It's a big leap for a lot of people at the present time, as they feel uncertain about the vaccination process with COVID in general. But I think what we've been able to understand on, fairly limited size research, so we have just over 3,000 participants in studies that we're assessing this on, is that the vaccine has been shown to be safe, and that we don't see any serious side effects at the present time. That being said, we don't have any data on the myocarditis side effects because we have not seen it. And I'll speak to that a little bit further later on. But what we do have data on is the side effects through the simple things like sore arm, redness, fever, general malaise, unwellness, that sort of stuff. And there is sort of clear data on that. Equally, we understand that the efficacy for this age group is comparable to what was experienced in the adolescents, so the 12 to 18-year-olds. And that's in and around 90%. The dose for this age group population is one-third, 30% of the dose that the adult population, or the 12+ population, gets. And the reason for that is when they really sort of tease that out in terms of the amount of vaccine required to give that efficacy, it was found that the efficacy was maintained at this lower dose, but with reduced side effect profile. So that was a big factor, both in the unknown context of myocarditis and also in all the general sort of system side effects. So we've maintained the strength of the immune response while minimizing the response of the body in an unwanted sort of way, like we have with vaccination process. The other thing that's different about this is that we're on an 8-week time interval. So many of us got a 21-day interval for between first and second dose, but for the 5 to 11-year-old population, NACI has been given guidance to use an 8-week time interval. That seems challenging in conversations a lot of times right now also, because people ask, well, is that adequate for them? Is it safe for them not to be vaccinated before Christmas? I was expecting this might happen. So the theory and the ability behind that is simply that we've sort of learned as we moved along. Many of us, were very eager to get our vaccine, and at the time, Pfizer had done all the research on a 21-day interval as the average. It was 19 to 28, and that's what we worked with. Then we ran into challenges with vaccine supply. And as a result of vaccine supply challenges, we had to push that window out through NACI's recommendations in order to keep our population getting vaccinated. The benefit of that unfortunate experience was that we learned a bit more about our immune system's response to the vaccine. And we've since learned that on an 8-week interval, we actually get better immunity than we do on a 21-day interval. We give our body better time to respond to that first dose before we ask it to mount a surge response to the second dose. and that's been really helpful. They've noticed that in the kids as well, and that's the reason for the extended interval. It's not a vaccine supply issue, but it should, again, help them minimize with side effects. Again, the focus being on minimizing that potential for myocarditis, knowing that it happens most commonly after the second dose with that broader interval in between. The only other difference in the vaccine is that there's a buffer component that is similar to the Moderna vaccine that is now different in the 5 to 11-year-old preparation. And the actual product that it's diluted with is different in it being normal saline. The rest of the vaccine is similar. It's marketed differently, so it has a different color so that it's easier for people to see which one is which. And it has all the usual regulations around how many doses we get from a vial, etc. So a lot of good process around it, a lot to still learn because, as I said, the research studies are small, but there's been very good conversation, not just at a NACI level, but sick kids and various, top research in children's hospitals have been really pushing conversation about this. The pediatric community has attended a lot of meetings last week or in the last 2 weeks, speaking to the infectious disease experts together with the pediatric cardiologist and really having all those very open and honest conversations about what they understand and what they're seeing in their patient population and what they're advising. And so that's what we're here to share with you in the knowledge that we have learned as well. I'm going to pause there for now. I'm going to hand over to Andrea for a moment. And as I said, she's our child life specialist with the Maternal Child Program, because a lot of the questions I also hear from families, aside from the medical ones, are how do I prepare my child for this vaccine process? And that is definitely her skill set.
Hi, everyone. Thank you very much, Dr. Van Schaik. I'm happy to be here to provide some support in this way. So as a child life specialist, it is our role to provide information to children and youth in an age-appropriate and accurate way. And this allows them the space to ask questions, to feel empowered and prepared specifically for medical experiences. Child life specialists also provide strategies to patients and families to help them cope with medical experiences through relaxation and distraction techniques. So I'm going to provide a few of those examples for everyone today. Some of the biggest challenges we are hearing about with children and youth with getting the vaccine is the fear of the unknown. What is a vaccine? How is it given? Where do I go? How long is it going to take? How am I going to feel after? And providing the basic steps to getting the vaccine is really important for empowering them to do this. The other thing that we know about children in general is that they like to have control. So finding opportunities in this experience to give them that, and of course in a reasonable way, is important for them feeling successful, and for you as well to help prepare your child for the entire experience. So first off, I said that the fear of the unknown is a very big deal. We want to provide children and youth with accurate and honest information, and taking the time to explain to them in an age-appropriate and accurate way really will allow that conversation to develop in a natural form for you and your child. And this will help them to feel empowered so that they have a greater understanding of what to expect. So some examples that I'd like to give are talking about it in a way that uses simple language. So for example, you might want to say something like, the COVID vaccine is like a medicine. This is something that we give the body. It doesn't help the body to get better, but it helps protect the body from getting something like COVID. You can also make it really fun and relatable for your child. So what sorts of things are they interested in? So for example, one way might be to explain it like, COVID is a vaccine that is like a superhero's power, and the power protects from a villain. Or maybe it's sports related. It's like the goalie on your favorite sports team, and it helps to stop the balls from getting in so that your team can win. And these are ways that might be more fun and relatable for your child to help understand within the world that they live what the COVID vaccine will mean to them. And this also then will create a space for them to feel more comfortable, to ask you more questions, maybe express some concerns that you weren't aware of, and also gives you a chance to prepare them appropriately. So the other thing is preparing them for the process. We go into these centers for COVID swabs. Maybe they've had an experience already, something similar, and they need to understand the steps to getting the vaccine. So where is it that you're going, specifically the location? Maybe you want to share with them the time of day and what it might be like. There might be a long wait time and the process of checking in and waiting after they get their vaccine. Another opportunity that I'd like to share, specifically, for the younger population, working with younger children, and it's a very powerful tool, is working through the steps with medical play. So having your child choose their favorite stuffed animal or a doll to work through the basic steps of getting a vaccine. This will allow them to practice and feel in control when they do go to attend their vaccine. So it really is a simple 3-step process, and depending on your child's needs, you can expand or say less. You know your child best. So for example, you may want to collect something that is either as similar as possible or an actual alcohol swab, a pretend needle, and a Band-Aid, and explain to them and work through the steps together that the nurse is going to one of 3 steps, first going to use the swab to clean the area, and then the second step is the poke to give you the vaccine, and the third is the Band-Aid, and we will celebrate when it's time to go. So lastly, just to quickly offer some ways to help them cope and provide choices that you can discuss during your conversations about explaining what the vaccine is, as well as working through medical play or the steps. You can offer that they will have the choice of which arm they'd like to have the poke in. Would they like to count? Is your child someone who would like to know 1, 2, 3 and take a deep breath, or would they prefer to look away? When talking about a deep breath, it's important for younger children to understand that taking a deep belly breath to really blow out their birthday candles, for example, is really helpful because we don't necessarily reach as far into the belly to have that relaxation that is needed for that initial poke that happens. Maybe they want to choose to look away, maybe they're interested and they want to watch. Some kids are very curious, and having the control of being able to actually see what the nurse is doing is something that is important, and we shouldn't discourage that. But if they want to look away, talk about things that they might choose for distraction. This will also help during wait time. If you end up needing to have a period of time, if there is a long line, then these types of comfort items that you could bring with them will help them during the poke, but as well as before and after. And also, lastly but not least, having them choose something that they can celebrate with after. It could be as simple as a Timbit, a sucker, a sticker, to something more elaborate based on your family situation if you choose. I've been speaking with children recently too about how they're feeling about this. Maybe they've watched their older siblings already get it, and I've asked them, what are you looking forward to doing once you have the vaccine, if you choose to do it? And most of them are just so excited to easily play with their friends and not to, be discouraged about not being able to play on their favorite sports team, and even bigger and better, go on a plane and fly somewhere warm. So these are all of the things that kids are thinking about that would be helpful to encouraging the process. There's also lots of great resources that hopefully we will be able to share either by email with everyone. There's videos to help prepare your child for the vaccine. One of the benefits of going through all of this is that more resources are easily shareable, and they are very attainable, especially through the Sick Kids website.
Okay, thank you. Did we want to go to Dr. Makary or Dr. Van Schaik? Did you?
Yep, back to me would be great.
Great. Thank you.
Thank you. Okay, so first thing I'll talk about next is just the why kids. So I know Dr. Makary has voiced this as well in terms of what he hears in his patients coming into the office. And it's so kids are less affected by COVID, so why is it important for us to vaccinate them? Very common question. So from our perspective, the importance is fairly obvious in the fact that it does affect kids. Much as they're less severely affected than the adult population, there is risk. And we certainly have seen children in our institution who have had COVID. We've had kids who we've had to transfer to sick kids for ICU care who have had COVID. The research definitely shows that kids who experience COVID illness are subject to MIS-C, which is multi-system inflammatory disease in children, as well as long COVID, not without complication. Separate from that is obviously the risk of myocarditis, which I'll speak to next, both with COVID, separate from the vaccination process. And we do see that complication quite significantly in COVID at about a 10-fold increase from what we see in the normal population experience with the adults with vaccination. So, but I think for the kids, what's really important about this is that they feel they're part of this system that is moving forward and getting protected through this illness that has captured us worldwide. B, that they're able to ensure their own wellness, but also the wellness of their loved ones around them. Sometimes they have immunocompromised people in their family or people with illness or elders that they feel they also want to protect through their own vaccination process. And then lastly is just, getting back to life as they know it. Right now, they're challenged by attending school. They're not able to get to extracurricular activities in the same way. They're not able to assemble with friends in the same way. And, trivial as that may seem to us as parents, because we know we're protecting them, they're really big factors depending on the age of the child and quite wide spectrum, even in 5 to 11-year-olds, on how important that is. We've seen the impacts of mental health on all of our kids, and this is a factor in that. So those are the large reasons why we're really advocating for vaccination in the kids, recognizing that their burden of illness, their likelihood of more severe illness is less than the adults, but there are many other challenges that are equally as impactful or more so for them individually and personally. So on the myocarditis front, we're going to learn as we go on this front, completely honest and transparent in that way. We don't have good statistics on this yet because the trials have not shown any evidence of myocarditis in the population for the 5 to 11-year-olds post-vaccination. What we do know is what we experienced in the adults and or the population that was most affected through the adult 12+ vaccination process, which was largely males in sort of the 15 to 24-year-old age group after their second dose. More significant with Moderna, but obviously there with Pfizer. So when we compare that research and literature to what we know about myocarditis in general, as I said, and compare it to COVID illness, there is a 10-fold increase experience of COVID myocarditis illness compared to secondary response to vaccination process. The myocarditis experience with vaccination in the 12+ age group was brief. It usually lasted 3 to 5 days. It was a return to normal cardiac function without significant impact. When you look at the studies, if you look at hospitalization, it's a hard thing to look at because most of the kids weren't hospitalized for illness, but for assisting with investigations, that being echoes and ECGs and stuff like that, so that we could gather that data to understand what was going on. But in essence, compared to standard myocarditis illness separate from vaccination, it's a much briefer illness, full recovery, and without significant impact during the hospitalization and or recovery process. When we look at what myocarditis is like as an illness across the pediatric age group, we do know that in the 5 to 11-year-old age group, there's a significant drop off in the incidence of general myocarditis. So it's much reduced compared to the adolescent and young adult population. So by inference, we're expecting there to be less impact on the vaccination front if the baseline illness is also already reduced. It's a different process because it's a viral illness in, one that's contracted outside of vaccination, whereas it's an inflammatory response due to the vaccination process. But in all honesty, we're going to learn as we go on this. The cardiologists, both at sick kids and through adult centers abroad, and Dr. Singla himself, have supported the fact that kids who have had previous myocarditis should not be deterrent from getting the vaccination. If you have cardiac illnesses for your children, they should equally still get the vaccine. There is not a contraindication in that way. The only contraindications that the cardiologists support are the ones that were there for the adults, which is allergy to any of the vaccine components or prior significant allergic response after the first dose. So that's sort of, I think that's it in a nutshell, based on the why kids and what do we know about myocarditis at the present time. And maybe from here, Lindsay, we can look towards questions and answering them as a panel.
Sure, sounds good. Okay, so we had a few that were pre-submitted that we can get to first. So one was, my daughter is 7 and was diagnosed with Kawasaki disease 4 years ago. How do I know if the COVID vaccine is right for her? Should I request echo and or ECG to ensure the mild dilation of coronary artery she has been fully recovered? Also, what kind of side effects should I pay attention to given her previous medical condition?
Yeah, common question. And I've heard this one answered by the cardiologist specifically, and their recommendations are that you would proceed with vaccination, no concerns about her previous illness, and that for anybody receiving the vaccine, any signs of chest tightness, accelerated heart rate, or chest pain should always seek medical attention. But, you know, the other factor in that is just if you have the opportunity, have those conversations with your healthcare provider. It's always good to be informed and make sure you're both reading from the same page, as well as the fact that, and Lindsay will put this in the information shared afterwards, Sick Kids has a COVID vaccine consult service that families can book appointments for. You don't need a referral from your family physician, but you can ask all your vaccination questions and get an answer to it. It's a virtual service.
Okay, let's see here. Can a child who is turning 5 next year get their vaccination once 2022 has started? So if his 5th birthday was in July 2022?
We're hoping so. You know, initially with the adults, it captured the year of birth. And then when it came to kids, initially, they started with, you know, you had to be X age for the time of vaccination. So we're hoping that NACI will support the year of birth moving forward for the same reasons.
Okay. And there's a few about flu shots and COVID vaccines. Can children receive these at the same time, or do they have to wait? Is there any risk there?
Yeah, there's different opinions on this at the present time. So NACI has indicated that they would like people to wait 2 weeks on either side for the 5 to 11-year-olds. That's out of an abundance of caution, because if you remember early on in our vaccination process, they had equally said they wanted 2 weeks before and 28 days after a COVID vaccine to get another vaccination in the 12+ age group. But they moved away from that more recently, recognizing that they hadn't seen any, you know, concerns and that supports normal vaccine process. With the kids, they're being cautious for the 5 to 11-year-olds for the same reason. They just want to make sure that there isn't anything that would be confounded and, you know, be able to identify which of the 2 vaccines was causing the side effect. That being said, we're very behind in our routine vaccination process in Canada as a result of the pandemic, because public health and or, you know, the ability for primary care to see all of their families and continue routine vaccination has been challenged. And so the Canadian Paediatric Society is really advocating that kids get vaccines, even if they're co-administered at the present time, if there's a barrier to that family being able to maintain getting that vaccine in a reasonable period of time. So by example, if it's a more remote location or there's issues that are going to affect being able to get another vaccine in 2 weeks, then they're suggesting that they would support co-administration of vaccine, because we do this with lots of vaccines. It's not uncommon to have more than one vaccine administered at a time, as we would have done in flu season as well.
Is there somewhere you can access data about how many children in this age group have been vaccinated to date worldwide, and do we have a percentage of occurrence of side effects?
Yeah, I don't know of a database right now that captures everything worldwide. What I know is that we have results on just over 3,000 kids with Pfizer. So Moderna still has their studies ongoing. I have seen research that has shown the percentages of side effects, but we haven't had any percentage of side effects related to myocarditis. So all of the side effect profiles are related to the common things: sore arm, redness, swelling, nausea, vomiting, diarrhea, fever, muscle aches, those sorts of things. And about 20% of the population had said they use, Tylenol or Advil, some sort of antipyretic or anti-inflammatory, just to manage some of those symptoms. But I'll keep my eyes open for it and share as we see it.
Sounds good. For children who are going to turn 12 in 2022, would they be better to wait until January to book their adult dose, or should they get the pediatric dose now? And could they get a second dose as an adult dose? Yes. Or children who are not yet 12, so if they're born in June, for example, would they get a pediatric dose until their birthday? And which is better? Like, is it better to get vaccinated, I guess, sooner rather than later, or should they wait until they're 12 to get the full dose?
Yep, common question as well that's been asked amongst the community presentations. So the recommendations are to get vaccinated with the 5 to 11-year-old dose as your first dose and get that immune system primed, get it going, build some immunity. And then if your child turns 12 in that 8-week interval, they will get the adult dose in the 30 microgram dosing. But there's also been recommendation that if it happens that they somehow ended up with the 10 milligram dose as that second dose, that would be okay too. But no reason to delay and wait to start the vaccination process, but that yes, after they turn 12, they would get the larger adult dose.
Okay. Have there been any updates on vaccines for the 6 month to 2 or 2 to 5 age groups?
Not yet. The research studies are going down to 6 months, both for Pfizer and Moderna, but we haven't had any updates as yet. Okay. Would Southlake do a vaccination clinic for the children of staff? We haven't planned for that. We've been asked. So the committee has discussed it. We have decided no at the present time, but we'll continue to entertain it as we hear it in our community.
Okay. Are you able to talk about what reactions to watch for with kids, as they would present differently and be described differently by kids, and what steps we should take for each of those symptoms?
Yeah, for sure. I think, the common things, the more serious ones that you're looking for are, the risks of myocarditis, right? So if they say their chest is hurting or they feel like, their heart is racing, sometimes they'll just say that it feels fast in their chest or otherwise, or a chest pain that they may describe, then those are things to get medical attention for more urgently, and our emergency docs are prepared to see those kids and do all the appropriate investigations. The more common ones are obviously the sort of, I'm not feeling well, my tummy hurts, my head hurts. Younger kids especially, will often reflect everything towards the abdominal area. A headache, an earache, an eye ache is always, I don't feel well, my tummy hurts sort of thing. Rashes are obvious because you can see them, but those are sort of the common elements. I don't know, Andrea, would you have anything else to chime on that?
You're live, Andrea, you can go ahead.
Okay, thank you. Yeah, no, I think that's a really accurate way of describing how children probably would respond. Just to add, if parents are feeling maybe a little bit weary of presenting them with these worries, that it's okay to offer very simply, again, some of the things that you would want to watch out for, and then being able to decipher between what is going to be more serious and how you're going to handle that with what is okay. That if we do feel a little bit unwell, that because of the vaccine, it's nothing you did, it's not your fault, it's just that sometimes we do feel a little bit achy and sore and tired, and that is normal. Just to help eliminate any other concern that, because they've chosen to do this or that they had to do this, that there was anything that they brought on themselves. And then just responding appropriately and saying, you know, if you are concerned about a reaction that is more severe, just reassuring the child that if you need to go back to check with the doctor to make sure that nothing else is going on, that they are the experts and that they are going to take really good care of us. And it's important for you to tell us and explain exactly where you're feeling pain or if there is something bothering you, so that we can make sure that we do the right thing to care for you.
Thank you. Somebody did ask in the chat if they were looking for specific direct support for their child from a child life specialist. So I told them that they could email you directly, just a heads up.
Yeah, sure. No problem. Thank you so much.
Okay. So somebody has written, so I've heard in the US that there was a mistake with kids getting the adult dose. What safety protocols are in place here to avoid that type of error?
Yeah, so I mean, public health is rolling out the vaccination process. So they'll have all their safety measures in place in each of the clinics individually, and obviously where you have it in primary care, they do this regularly and commonly, have processes in place that are standardized and accurate around vaccine administration. There are different labels and colors for the two vaccines. So it's obvious sort of which is the child preparation and which is the adult preparation. The amount that is administered is slightly less than the kids, although the component in terms of the amount is a third. But as I said, there are different colors to make that easy as well. And then whether it's at public health or in a primary care office, there's trained staff who are skilled in drawing vaccine and administering vaccine and all the process, both infection-wise and support-wise, that go along with that. So human error is definitely, you know, a part of any process in life, but certainly there are safety standards in place to minimize those and double checks.
Okay. Does Southlake have a plan if we have, where did that, sorry, I lost the question now. Do we have a plan for RED if children, when children arrive in RED with poor reactions to vaccines?
For sure. I mean, I think our emergency department physicians see reactions to whether it's vaccines or whether it's drugs or whether it's environmental aspects of life relatively routinely and are prepared to deal with that ongoingly. Certainly they have the support in our various departments, you know, the Department of Pediatrics being one of them, and so we're here to support them as well.
How soon will there be customized clinics for kids with special needs, so developmental delays, phobias, etc.?
I haven't heard specifically, but I would expect, you know, it should roll out coexistingly more or less, because we did this with the adult population and had specialized clinics for adult with special needs. But I think with the kids, that will be quite simultaneously occurring, would be my expectation. You know, having separate clinics for them would be a little bit, I'm not sure if public health is planning that specifically, but rather individualizing the process for each. So sometimes as people come for vaccination, you know, knowing the needs of that person, explaining the needs of that person and addressing them individually in the setting, in the timing, in, you know, the comforting, will all be there. There'll be very child-friendly environments as well, and they'll have to address accessibility and needs as well.
Can kids with asthma get the vaccine without any side effects later in their life or at the time?
Yeah, as far as we know, asthma has not been a barrier to vaccination. Our asthma population has done really well through the COVID vaccination experience so far. They've been very compliant with their medications and have done really well, unfortunately, out of, you know, largely not having a lot of contact through school environment or otherwise, but overall as a population, they've done very well. But there's no unique aspects to their illness related to the vaccination for this illness.
If myocarditis occurred as a side effect, how late would it show up? And is it a lifetime condition that could affect the heart long term?
So it usually shows up within the first 3 to 5 days. It typically related to the vaccination process has not so far been seen to be a long-term process. It usually resolves within about a week, 3 to 5 days itself. It can show up a little bit later, but the most common time is usually within the first 3 to 5 days. It's usually a fairly quick response. The ones that we see, or the ones that the cardiologists have seen sort of later on, a couple weeks later, a month later, they're very suspicious about whether or not it was the vaccine or an independent process. So that's being teased out a bit, but the vast majority have been within the first couple of days, usually self-resolving within 3 to 5 days themselves without any significant long-term effects. When you look at the graphs on the research, their cardiac function all returns to baseline, whereas when you look at the graphs for normal, I say normal, myocarditis that is affected by non-COVID vaccination, those baseline effects are not nearly the same.
For healthy children with no comorbidities, is there a bigger risk of complication or side effects from the vaccine or severe complication from COVID-19?
No, there are some populations that are felt to be at more risk for illness with COVID-19. In large part, we've heard childhood obesity being a factor, neurological issues and development, some respiratory illnesses, but not asthma. And then separate from that was type 1 diabetes. And those are the sort of main four that a lot of people talk about. Obviously, there are some others. Any immunocompromised state is the obvious one that I didn't say that is a factor as well.
Is there a concern for children who were born prematurely, so like 7 to 8 weeks early or even 3 to 4 weeks early?
No, in fact, in our vaccination process doesn't differentiate on that in the normal routine. We start administering vaccination based on their day of birth and not on their chronological or corrected, or not chronological, but corrected age. And so, for many things in a child's development, we go by their corrected age if they're born early, but vaccination is not one of them. So no increased risk there.
Your attention, please. Detected code blue. Level 5, East Cardiology, bed 1.
Okay. If children were born with heart murmurs, would they be at a higher risk for cardiac side effects?
No, and that was directly asked at Sick Kids by to the pediatric cardiologist there, and they quite clearly indicated no, there would be no implication.
Okay. And somebody asked if you have children taking Tylenol or Advil to help with minor symptoms, is there a concern that it could mask more serious adverse reactions?
No, I don't think it will mask or prevent awareness of serious adverse reactions. The recommendation is not to give it before the vaccine is administered, but to support with it afterwards for any side effects or discomforts. But before, you just want that immune response and that inflammatory response to be full to create the body's ability to build.
Does the size of a child affect how well the vaccine will protect them?
No, so that's been a debate with respect to the dosing of this vaccine, right? So if my child, a lot of people will say, if I have a big 10 or 11-year-old, should they not just get the adult vaccine because they're large in size, their weight is comparable, etc. The infectious disease specialists really advocate on it being more of a developmental stage of the body's systems and not just their physical size and weight, but rather reflected in, some of their hormones, some of their systems development, etc. And even if you're an early bloomer, they don't feel that that's a contributing factor.
Do you think kids will also require boosters of this vaccine as time goes on?
Yeah, we'll have to see. The biggest debate right now is, a booster / third dose around the immunocompromised population, as we've done with the 12+ age group. And so that I would expect for similar reasons, but in, science, technology, and vaccine understanding. Whether we're going to require a booster for the average sort of 5 to 11-year-old who's otherwise well and healthy, we'll have to see as these studies continue to look further out now, because, they've only looked at about 12 to 16 weeks at this time interval. And so we're going to need to look further than that to be able to understand it. So jury's out on that one right now.
My daughter did not receive her immunization for age 6. Should she do this first before getting her COVID vaccine?
Right. So, and that's the debate, right? Is which vaccine do you want to do first at the present time? You know, my recommendation in the context of the current pandemic is, were it being my kid, I would probably get them the COVID vaccine first so that I started their protection for this season. Henceforth, we're going indoors, it's winter, etc., from their exposures to COVID-19. And then I would book their 6-year-old vaccination, 2 weeks later, 3 weeks later, and ensure that they got caught up.
Okay, somebody's asking if you are administering counseling or vaccinations in your PATH clinic.
No, we're not. We're a consulting service over at PATH, so we haven't taken up the opportunity to offer vaccination, but maybe I'll let Dr. Makary indicate what primary care is doing on that front.
Sure, Dr. Makary, I will send you live.
Thank you for that. So there are some primary care offices that will administer the childhood vaccination. Currently, the ones in our area that are administering the vaccination are doing adult vaccinations, so they do have some experience with COVID vaccines, and they may choose to shift to childhood vaccinations, but that is not the case yet. We do have primary care providers assisting public health in their vaccination within the school hubs. So although you may not get your child vaccinated with the COVID vaccine at their primary care office, your primary care provider may be assisting public health through the different hubs and administration programs across the region.
Thank you. Okay, put Dr. Van Schaik back up. Okay. Is there any correlation between reaction to a vaccine and how someone would react to the actual virus? Why does the vaccine hit some people harder, like not adverse reactions, but general side effects, that sort of thing? Do you know?
I don't know. I honestly don't know on that front. We do know, that by example with the child population and MIS-C, that multi-system inflammatory disease in kids that we've seen, it is not differentiated based on the severity of illness. So you could have mild COVID illness or more severe COVID illness, and your risk towards progressing with MIS-C is the same. And so from the perspective of, COVID illness and or vaccine response, I'm not sure. I don't know that anybody knows that yet. I know I had my booster dose on the Wednesday that we started it internally, and I felt a little bit off the next day, certainly had a little bit of local tenderness, but I know other people that were more impacted than that. And some people have had that with their second and booster doses and or first doses. So it's variable. I don't think it reflects on whether you have a good or a not as functioning immune system at all. I think it's just your individual response to these processes.
Okay, lots of questions about, and you did speak to this early on, but maybe we'll just sort of reiterate. So why people should get their healthy children vaccinated if the adults in their home are vaccinated and if they have little to no risk of severe complication from COVID.
Yeah, so my advocacy there is really around, one, protecting them. This vaccine is very similar to the other vaccines that we get our kids protected for illness around. Chickenpox, measles, mumps, rubella. When you actually look at the data for how they were developed, what degree of illness they prevent, both in terms of community illness and hospitalization, COVID-19 has been more impactful than all of those illnesses. By example, it's about twice the amount of hospitalization than we see with chickenpox and severity of illness. And we've taken up those opportunities because it's right. It helps protect our community at a larger level, because as our kids have these illnesses, they share them with other people, which can be impactful for, by example, expectant moms, immunocompromised people, your 80-year-old grandma, or otherwise. But even in the situation where there's really, no perceived risk by you to family members or otherwise, there's a lot of benefit to the child. They're protected. They get to equally be able to interact in society better. You get to interact as a family better. And from a mental health perspective, especially for the middle-aged kids, they speak to this. We don't think they do, but they actually voice their opinions about this and wanting to feel protected for their own safety. I think it's something that they carry with them in anxiety and stuff in that regard. And we're seeing a ton of this in the pediatric populations, as I'm sure Dr. Makary is in families in their office. The other factor is just, they get to not be isolated from school nearly as much. They're sent home regularly right now with a cohort contact and then having to isolate and then taking school from home. They've had so much disruption over the last year in their normal routines, their ability to socialize and maintain good relationships, that I think it's really an important part for us to advocate for them, because their voice can only be so loud. But it is a personal decision for any family. And I would invite people to really talk about it with their kids, because I think sometimes you'd be surprised at what they share.
Beyond the USA, what other countries have started vaccinating this age group?
Well, some of the research has come out of Israel as well, Britain, places like that. So there's some parts of the world that are still, struggling with their vaccination process. But everybody's sort of moving forward with supply and taking up the age groups.
Okay. You may have spoken to this already. What percentage or ratio of kids are having adverse reactions? So Miss-C or myocarditis, if we know.
Yes. So of the population that experienced the myocarditis side effect in the 12+ age group, it was 0.01% of individuals being vaccinated. And as I said, that was mostly in the males, were the higher risk category, sort of the 15 to 24-year-old age group. And then there was another peak sort of in the 80+ age group. But that was largely the incident that they experienced compared to the myocarditis experienced with COVID illness was about 10-fold higher. So that's what the raw numbers show. With respect to the side effect profile, I'm just pulling up my phone here because I have some slides from a presentation I was at. The most common ones are pain at the injection site, not surprising, 75%, right? The lower ones are in the areas of chills, vomiting, diarrhea, in the less than 10%, sort of 5% range. But the more common ones sort of in the, 10 to 15% range are sort of redness, swelling, pain at the injection site, obviously. Fatigue, that's another common one, sort of in the 20-25% range. And headache is the other big one. I think we've probably all felt that when we've even had our flu shots, right? It's like sometimes you just feel crappy for a couple of days, or sometimes it's just that headache that feels like you're dehydrated or you haven't eaten in a long time. And it's just right at the front of your head there.
Yep. Thank you. So that looks like it's it for vaccination questions. There is a question here. Could you suggest any strategies for kids who are scared of the COVID test? My 7-year-old has had to have 3 so far, and each visit is worse than the last in terms of her fear and resistance during the swab. I don't know if we can put her through it again, but I worry that if there's an exposure at school or if she develops a runny nose, we'll have to. Any suggestions on making it less traumatic?
Yeah, well, I'll let Andrea answer that too. I do know that there is the spit test out there as well, which is less traumatic than the nasal swabs, although they're not as broadly available. And the kids have to spit a fair amount of substance into the tube in order for it to be successfully tested. But I'll hand over to Andrea for her pearls on this.
Great.
Hi. Yes, this is increasingly becoming a bigger challenge for kids, for sure. The more they need to do it, the more resistance they have towards it. So again, with the medical play, this is something that you can practice at home. It also will allow opportunity for your child to act out their frustrations, explain to you anything that they are thinking about. Maybe there's a misconception around the process that you can talk to, and giving them the opportunity to practice this will allow them to feel more empowered. So for example, you could use a Q-tip on a doll and have them administer it and have the control over it. Also too, it varies depending on potentially where they're doing the COVID swab, if it's both noses, maybe they have the opportunity. You can call in advance and say, what is the practice at the center, so that I can properly prepare my child to know what to anticipate. Sometimes they're doing it in one nostril and sometimes they're doing it in two. And then you can give the choice, if there is a choice, to do it in one side versus the other. And again, finding ways throughout the experience to provide control. So maybe it's a comfort hold. Do they want to face forward and look towards the nurse? Would they rather look away, so they could be wrapped around you with their legs towards the back, so that you can give them a nice supportive hug, also securing and ensuring that it goes as quickly as possible, and relating it to previous experiences. So what is it about this that they don't like? Is it just that it feels so strange, or does it actually really hurt? And helping them recall previous experiences that maybe hurt more or less, and helping them to have that ability to express what it is exactly about the experience that is so yucky. You can also make it really fun. We like to dig for boogers. We don't need them in there. Does your child respond to something like that? Give the nurse your boogers, you know, and really trying to create a fun experience in some way, so that it becomes a little bit more friendly and normal, because until we all, you know, move forward potentially with more vaccines, this isn't going away for our children who need to be in school and in daycare, and also maybe too finding a friend who also has having to do this quite often. There's going to be lots of kids talking about it at school. Maybe there's a way that they can connect and share, you know, either they want to just explain to the friend that it was terrible, or maybe a family member, or they want to talk about, you know, what did you do and what did you do after, to help them relate on a social level with each other, because kid to kid is really beneficial, and so many kids are doing this. So helping just to normalize the whole experience for them would be really helpful as well.
Okay, thank you. That was really helpful. There is one last question, so I'll put Dr. Van Schaik back up to answer that. Okay. Do we know if the vaccination has any effect on puberty? My kids are showing signs of puberty.
Yeah, and that was asked a lot through the young, you know, the teenage years as well, the 12+ age group, and the fear around hormones. Fertility was the big question. Is this going to affect their fertility? Everything we've learned about that has been supported with no concerns around the hormonal process. And they've actually, some of the talks that I've attended from sick kids and researchers abroad have looked at this in animal models and equally found there not to be a difference. And, you know, so as a translatable comparison, but no concerns from what we've learned so far and the messaging we've been sending. And I think Andrea's message is just recently that they're great, because I know the Ontario government through the school boards are going to be sending home kits with all the kids from school to be used over the holidays for at-home testing. So those are some great strategies for doing it yourself at home. And, you know, sometimes that's easier because it's a comfortable environment. Sometimes it's harder because you're a parent, and it's a very different role to then have to do this to your kids as a parent, as opposed to somebody else being the meanie, so to speak.
Great, thank you. That's all for questions. Did you have anything you wanted to say to close?
Well, just thanks to all our panelists, both in Andrea and Dr. Makary and Dr. Singla, for the information he provided. We'll continue to provide updates on what we're learning from this, what's changing about it, and what the experience is, especially around side effects, because that's going to be really important. So we'll look to do that in our regular town hall updates. If you have questions outside of that, just let corporate communications know. And sometimes they're very unique and specific, and we're happy to field them individually. If they're more broad-based questions, then we usually bring them to town hall and answer them so that everybody can hear them at that time. And otherwise, I just encourage everybody to take the opportunity to get their kids registered and vaccinated, support them through the process, and we're here to support you. Have a great day.